Hey, my name is Dr. Sean Price, Clinical Coordinator here at Chiro Spa in Fort Walton. In the last video we talked about the three-pronged approach that we take to our healing process and our healing system that we use here in our office at Fort Walton. We call it our rewired system because we're actually rewiring your metabolism, we're rewiring your brain function, we're basically rewiring your body to get things moving and functioning the way that they should be functioning. We talked about you have the metabolic aspect of care, which is taking food and converting that food into energy. We talked about how that energy production that happens through the metabolic process, the brain actually consumes 30% of that total fuel produced. So if you have bad metabolic processes, a lot of times you end up with bad brain function. And then we also talked about what we do with those things, and we talked about how we also include structural care into our treatment protocols. Well, today I wanted to break down the metabolic process a little bit, and we go over this extensively in our workshops that we do, whether we're talking about blood sugar workshops, whether we're talking about Crohn's disease, IBS, GERD, heart disease, heartburn, acid reflux, whether we're talking about thyroid disease, autoimmune conditions, anything that we're talking about, we always talk about the metabolic process because it's critical to life, it's critical to the energy of life. So I want to give a basic rundown of the metabolic process. So basically what happens is your hypothalamus, it's a part of the brain, it's basically the regulatory center. It regulates our sleep-wake cycle, it regulates our appetite, it regulates our hormonal function. It basically takes in all the information of what's going on throughout the body and then sends out signals to regulate what's going on with that. So if there's a need for increased metabolism, the hypothalamus is going to send a signal to the pituitary gland. The pituitary gland is going to release thyroid stimulating hormone. What that does is that signals your thyroid gland to release T4 and T3. These are the main thyroid hormones. T4 is inactive and T3 is active. What that means is T3 is basically in the form that the body can use. So it goes on and is used up by the body. Because T4 is inactive, and the T4 needs to be processed so that it can turn into T3 so the body can use it. So T4 goes to the liver, to the gut, to the kidneys, and to all the other tissues in the body for that conversion of T4 to T3. Okay? So what's important about this? Well, first of all, the thyroid gland makes T4. 93% of what the thyroid gland makes is T4, which is the inactive form. So that's the majority of what's there. It has to be converted for the body to enjoy the full benefits of the metabolic process. If you are determined to have hypothyroidism or low thyroid function, then what happens is you're usually given either Synthroid or levothyroxine, something along those lines, which is a synthetic form of T4. And that tells the hypothalamus there's enough T4 so your TSH levels go back to normal, so everything looks like it should be functioning the way it should be, or that it's functioning the way that it should be. But the reality of it is that T4 is still not usable by the body. It has to be converted. So if there's a liver issue, if you have some kind of a liver malfunction or suboptimal function of the liver, if there's a gut or a digestive issue, if there's a problem with the kidneys, if there's other cellular issues going on, you're not going to convert that T4 to that T3, so you're still going to have thyroid symptoms even if your lab tests are normal. So remember, even though your TSH may be normal, there's a ton of other tests that need to be run to check the thyroid gland to make sure that it's working properly. And it's not just the thyroid gland, it's also the pituitary. It's also the connection between the hypothalamus, the pituitary, and the thyroid gland. It's also your adrenal glands, it's also your hormones, it's also your blood sugar. There are a lot of factors that go into the metabolic process. When we go into our workshops or the DVDs that we have for people, we go into detail about these processes and how they affect each other. But this is a basic overview of the metabolic process. If you have any questions, feel free to post it below. I hope this makes sense, and we'll see you on the next video.